HS 2012-38 through HS 2012-40.
Support.
We have a motion by Commissioner Nash, second by Commissioner Foster. Are there any comments, questions, or concerns? Seeing none, Madam Clerk, may I have a roll call, please?
Commissioner Mahoney,
Yes, on all.
Commissioner Nash,
Yes on all.
Commissioner Skolnick,
Yes.
Commissioner Wilkins,
yes,
Vice Chair Foster,
Yes.
Commissioner Hovey Wright,
Yes on all.
Commissioner Laring,
Yes, on all.
Chairman Hughes.
Yes on all.
8 yes, 0 no on all.
Thank you very much, and that
Thank you,
motion
That
carries.
will conclude my report.
Thank you very much, Commissioner Nash. Next, we have our Ways and Means Committee agenda. Commissioner Skolnick, please.
Thank you, Madam Chair. The Ways and Means Committee met on December 1st, 2020. It was recommended, and I move WM 20/12-115, 116, 117, 118, 119, 120, 121, 122, 123, and 124.
And support.
We have a motion by Commissioner Skolnick, a second by Commissioner Foster. Are there any comments, questions, or concerns?
Yes, did that
Yes.
include 114?
Let me
I
see
didn't
here.
hear that.
It's not on there.
It's not on-
114 is not on there.
But I got an old,
115.
yes, that was on the old one.
24.
oh, okay.
Marcia, you get a special agenda.
Yeah, okay.
All right. Madam Clerk, anyone else? Madam Clerk, may I have a roll call, please?
Commissioner Nash,
Yes on all.
Commissioner Skolnick,
Yes, yes on all. Thank you.
Commissioner Wilkins,
Yes on all.
Vice Chair Foster,
Yes on all of them.
Commissioner Hovey Wright,
Yes on all.
Commissioner Laring,
All right, unfortunately, you're going to have to pay attention. 115, no. 116, yes. 117, yes. 118, yes. 119, no. 120, yes. 121, no. 122, no. 123, no. And 124, yes.
okay, bear with me here 1 second, please.
You can give her his copy.
Commissioner Mahoney,
Yes, on all.
Chairman Hughes,
Yes on all.
$115. I have 7 yes, 1 no. $116, 8 yes, 0 no. $117, 8 yes, 0 no. $118, 8 yes, 0 no. 119, 7 yes, 1 no. 120, 8 yes, 0 no. 121, 7 yes, 1 no. 122, 7 yes, 1 no. 123, 8 yes, 0 no. 124, 8 yes, 0 no.
Thank you very much, and those motions carry.
That completes my report, Madam Chairman. Thank you.
Thank you very much,
I just
Commissioner
have
Skolnick.
a quick question. Which
Sure.
item that was on the prior agenda was removed?
It was a duplicate.
Oh,
Oh,
that's right. Yep, that was a duplicate.
okay. Thank you.
Next, we will move on to the chairman's report and committee liaison reports. First of all, I think it seems like our corporate counsel had asked me to have each one of the county commissioners tell where they
They
were
were,
signing in from. So, Madam Clerk, I would like for you to call each county commissioner's name and just have you tell what city you're calling in from.
Vice
Sorry
Chair
about that.
Foster,
Muskegon, Michigan.
Commissioner Hovey Wright,
City of Muskegon.
Commissioner Laring,
the City of Muskegon boardroom.
Commissioner Mahoney,
The largest city of Montague.
Commissioner Nash,
I'm in East City of Muskegon.
Commissioner Skolnick,
City of Norton Shores.
Commissioner Wilkins,
City of Muskegon Heights.
Commissioner Hughes,
Muskegon County. And thank you very much. Now that we have officially declared where we all are, I will move on to an important event for us, which is the County Administrator's Annual Evaluation and Employment Agreement Renewal. I appreciate all of you sending in your information and your evaluations. As is my job, I went through that very thoroughly with the County Administrator. He's done an excellent job according to every one of us this year. We have gone through some difficult times, and we certainly appreciate his patience with all of us and his leadership in our county. His annual employment agreement renewal is you have been presented with. I would like to say I'm very happy with this, very pleased. My only concern at all was that this year, because of it being an election year, we normally give our administrator a 3 to 5 year contract, which I would love to have done. But this year, because it being an election year, we can only extend his agreement for 1 year, although it can be changed at any time after this year, but it will start January 1st. Do I have a motion to approve actually, I will make a motion to approve the administrator's annual evaluation and employment agreement renewal contract. I'm looking
I
for
will
a
support.
Support.
motion by Commissioner Nash. Commissioner Javi Wright, did you have a question, or was that just a motion?
That was a second.
Thank you very much. Does anybody have any questions?
Yeah, Madam
Bob?
Chair, I'm
Yes.
just curious. Well, I'll just ask Mark directly. How many years have you been in this position now, Mark? 3?
It's completed the 6th year. 6
Really, 6 years.
already.
Plus 2020 counts as 5.
Yes.
And he was also the director of the wastewater for many years before that. So he came with a history in Muskegon County. Anyone else?
I would just like to add that, I remember when we were in search of, and one of the things we were looking for was somebody that was from the county that would dedicate themselves to this county. And we were looking for at least a 10-year type administrator. I believe Mark has filled those shoes. I know he has truly grown in that position. And, I think he's halfway through the plan that we had for him in that decade of leadership. And I just wanted to make sure that I let him know and the community know how much I appreciate, his leadership and what he's done with the changes in the times and the changes in board members and pandemics, but I think he's handled things very well. And we just want you to know how much we appreciate you and the job you're doing and your staff.
Thank you very much.
Thank
Well
you,
said,
Commissioner
Commissioner.
Nash.
Yeah, I would like to just add that,
Marcia?
it's just a delight to work with Mark, and to know that he's going to take care of stuff, and he does. And it's, I don't have the history that Charles has, but certainly in the 2 years I've been here, it's been very, very great working with him.
Madam Chair,
Yes.
I have one complaint.
Okay, Bob, we're not taking complaints now. No,
Well,
go ahead.
It's a joke. I'm sure it's a joke.
He's too thin.
He's what?
He's too thin.
Yeah, well, this year's been hard on him, let's face it. And I would like to say too, Mark, you have just been, it's been a joy to work with you these last 2 years. I can't tell you how much I appreciate it and how much I appreciate all you've done for the county and how well recognized and how well respected you are in our communities. I really appreciate that.
Thank you very much.
No, Susie,
Yes, Commissioner
and
Wilkins.
also I'd like to add my comments too. I think Mark is doing a wonderful job, and his attitude towards the public and towards the people and helping the people is amazing. And I am so happy to be working with him and the rest of you in the county on the way people are being treated.
Thank you, Commissioner Wilkins. I
Thank
think we all echo that. Anyone else? Seeing none, Madam Clerk, may I have a roll call on this, please?
Madam Chair, if I may, I need to make a clarification on
Right, go
Ways
ahead.
and Means.
Yes.
Ways and Means 123. I
Mhm.
may have said 8 yes, 0 no, and I believe it was 7 yes, 1 no.
Okay, thank you very
We did
much.
do that, and I'm glad you corrected that.
Okay, thank you. Thank you. And would you give me a roll call on the administrator's employment agreement renewal?
Commissioner Skolnick,
Yes.
Commissioner Wilkins,
Yes,
Vice Chair Foster,
Yes.
Commissioner Heavy Wright,
Yes.
Commissioner Laring,
Yes.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Chairman Hughes.
Yes,
8 yes, 0 no.
thank you very much. We are certainly looking forward to working with you in the next few years. All right.
Madam Chair,
Yes,
it's definitely been a privilege and an honor, especially the last 6 years, working for this board and the community as well. I'm proud of what the directors and our staff of 1,000 have accomplished over the last 6 years in their dedication to this community. We've definitely seen that in the last 6-8 months. Working through COVID, we've had employees volunteering, helping each other out, volunteering to make it the best for the community. And that's a huge honor to be able to work with these employees, especially the directors and elected officials. We will always continue to be serious about our community and look out fiscally responsible in making sure that we take care of our community and the residents of our community. So it's an honor and definitely a privilege to work for you. Thank you.
thank you very much. We look forward to working with you too. Next is, we have a resolution recognizing the Health West staff from the county. Commissioner Hovey Wright will be presenting that to the Health West. We also have a proclamation that will be thanking all of the county employees too. I mean, we don't just single out one. We appreciate every single department and everything they've done for us. This has been a trying time for every one of us, and everybody has worked really hard. Marcia, would you present this to
Yes.
Health West? Are you going to take it over there to them?
Yes.
Thank you very
I
much.
believe I'll be presenting it at their next meeting. I'll have
Wonderful.
to check that.
Thank
Okay.
you so much. I really
So
appreciate
this
it.
is,
And I will make
I'd
sure
like to
that I will make sure that everybody gets that all the other departments get theirs too. Thank you very much.
great.
Now we will move on to.
Wait, I'd like to read that.
Oh, okay, right. Go
yeah,
ahead if you'd like to.
Because I
You want to read the one for the Health West or the one for all the county
Health
commissioners?
West.
Okay, go right ahead.
Health. Okay, so from the County of Muskegon, a proclamation. Whereas on March 11th, 2020, the World Health Organization declared the outbreak of coronavirus disease 2019, referred to as COVID-19, a pandemic. And whereas on March 13th, 2020, a national emergency was declared, mobilizing the entire U.S. in the fight against COVID-19. And whereas the professionals of Muskegon County Health West facility have worked tirelessly to provide top-notch care to individuals while inspiring hope and wellness in partnership with individuals, families, and the community. And whereas every individual in Health West facility, which includes 350 employees, work in the areas of case management, recovery coaches, peer support, clinicians, therapists, crisis response, nurses, administration, clerical, finance, information systems, psychiatrists, nurse practitioners, physicians assistants, licensed clinicians, clinical supervisors, social workers, psychologists, behavioral analysts, and coordinators have acted with excellence and professionalism in to ensure that the citizens of Muskegon County receive the care that they need. And whereas these professionals are dedicated to providing essential behavioral health services, as well as services in the area of developmental disabilities, substance use, physical health, and early intervention and prevention. And whereas these professionals have continued to provide excellent therapy and counseling services, even in the face of unique challenges presented by social distancing across Muskegon County. And whereas these mental health professionals have worked to educate our community and implement policies that will curb the communal spread of COVID-19 while having to face adversity of decreased staff capacity due to COVID positive cases, the need to quarantine, and the death of multiple colleagues. And now therefore be it resolved that the Muskegon County Board of Commissioners do hereby honor and extend our deepest gratitude to the staff at Health West for remaining resilient in the face of the crisis caused by COVID-19. Thank you.
I'm sorry, I had my microphone off. That's all I have under the chairman's report. Administrator's report is next.
Thank you very much, Madam Chair. I have two items here, consideration. The first one to extend, I'm not going to make the motion yet. I want to discuss it first because what we have in front of us is several things to consider. I want you to share, I want to be able to share those with you. So Kristen, could you put that up? The resolution to extend state emergency. It's the extra slide I sent you about 30 minutes ago. The process of going through what we need to decide what's best for our staff. We all heard from Kathy Moore earlier today about our state of the county, at least where we're at with the county, and that our numbers are coming down, but they're still quite high, much higher than they were obviously in the spring. So number one for consideration, we had the extended emergency declaration to December 20th. That came out yesterday, which really restricts on how we can meet the number of people in locations. The courts is very interesting as well. And I have, again, Kathy Moore stayed around for this, and so has Sandra Vanderhyde. She's here to join questions. The courts actually had to go back to phase 2, then back to phase 1 per the state court administrative office order. It'll take them 14 days of a downward trend to go back into phase 2, another 14 days downward trend to get back to phase 3. So at the earliest is January 11th is where they think they'll land by the phase 2. And again, that's a few employees working in the courts, but the majority are still working remotely. If you could scroll up a little bit, public health recommendation to the board and to myself was January 11th for this motion. And the reason that is because it gives you an additional week to 10 days after New Year's celebration to return to work. So if those may have COVID. Also, I asked our directors just today of how many are seeing positive in their office areas, or even though they're working at home, and how many of them are actually doing a 14-day based on their being around other people who have COVID, right? So the report is only have 4 that have actually tested positive in the last couple of weeks, which is greatly reduced than we did before we started working at home again. So I truly believe working at home has helped our departments. Departments are still getting their work done. They're still having appointments. Clerk Waters just shared with me yesterday the list of appointments they had today, and it was all by a time and a person that they knew who they were meeting with and knew who where to go, in a checklist. So each department is working hard through this process. The next 3 weeks, roughly, we have 2 days off at Christmas and 2 days off at New Year's Eve. So if you could go back to the motion, based on that information. Oh, one more thing on there I wanted to talk to you a little bit was the legislature House Bill 6207, which is extending the virtual meetings until March 30th. That was going to be discussed today and this week at the House. But the speaker canceled the sessions this week, so they're going to take it up next week. The writings on that, the legislature have in writing there that they would extend the virtual meeting until March 30th. So talking to Representative Sable, he believes that date will not change, and it's expected in the next couple of weeks. So taking all that in play and what's Kathy's saying about our numbers, what the numbers are actually telling us, it takes me back to my motion, and that's where our discussion is. Do we want to extend this out to the 11th, which would be further than MDHHS is? The other option is to follow what MDHHS, which is December 20th, or align ourselves with the courts, which makes sense, because if the courts are not returning to the 11th, I'd hate to ask South Campus to say that you guys can return, but the courts can't. It just works well with our employees to make sure that they are safe. Obviously, we need to serve the public, but we also need to take care of our employees. So if I was making a recommendation, I would push for the 11th. It doesn't mean that we can't come back to meetings, especially if the House Bill 6207 failed. We would have to meet, but it would be contradictory with the MDHHS. But there's a good, I don't know, we almost have a month in between now and then. A lot of things can change. Right. So as far as this extended declaration of local state emergency, I would recommend the 11th, but based on those facts I just went over.
Mark, thank you. And because of your recommendation and the recommendation of our health director, Kathy Moore, I will make a motion to extend the declaration of local state of emergency through January 11th.
Support.
I have a motion and a support by, was that Commissioner Nash?
Yes.
Commissioner Nash. Is there any comments, questions, or concerns?
Madam Chair, I have a comment, if I may.
Yes, please. Go ahead, Commissioner Herring.
So I don't agree with extending it into January 11th. I've actually requested it not be extended and that this burden be placed on the new board that's coming in. I would prefer that we just follow the state's guidelines, and we do have time to adjust. We could do it in December at our next full board meeting. If the state looks like they're going to extend, there's no reason we couldn't make that decision then. But I don't know why we have to exceed state lockdowns here at the county.
Thank you very much. Are there any other comments?
I would weigh in on this, that I think that this is a good idea, because as we see what happened with the Thanksgiving holiday, and we have Christmas coming up, and then we also have New Year's and New Year's Eve coming up. And I just see this still being a very volatile time right now, that this vaccine may be coming out, but the general public probably will not even see this vaccine until late February, early March. And I just think that right now this is a great idea, because if this thing spikes again after this holiday, at least we have this state of emergency until the 11th, and hopefully, like now, maybe that trend will hopefully be going down, or we'll at least know where we're at by that time to see if we need to extend it or not. Plus, if this new board decided that it wanted to change it, we could vote to make a motion to change it. So, I think it's good to be overly cautious to save some lives.
Thank you, Commissioner Nash. Anyone else? Seeing none, Madam Clerk, may I have a roll call, please?
Commissioner Wilkins,
Yes.
Vice Chair Foster,
Yes.
Commissioner Heavy Wright,
Yes.
Commissioner Laring,
No.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Skolnick,
Yes.
Chairman Hughes,
Yes,
7 yes, 1 no.
and that motion carries.
The second item for consideration is to approve the sheriff's office to terminate the current contract with WellPath Services.
So move.
Support.
We have a motion and a support. I do have, are there any comments, questions, or concerns?
Yes.
Question.
Go ahead.
I'm assuming we have some other vendor in place.
Yes, I have the sheriff on to answer those questions as well. And to answer your question, yes.
Would you please
Okay, good.
unmute the sheriff? Thank you.
Good afternoon, everybody. Mr. Mahoney, was that you, Commissioner Mahoney, that asked that question?
Yes.
Okay. Yeah, this is actually the termination of this contract is a response from an idea that really came in 2017 to provide an integrated delivery system for the inmates, where we'll be working. I mean, we've heard today on the resolution for Health West, from what's going on. The plan is to partner with them. This contract with WellPath it's a 90-day expiration on it. So we still have 90 days to kind of finish out the contract and move on from there. So yeah, we do have a plan in place though.
Any other questions?
I have a question, if I may. So did I understand that right, that the replacement for WellPath is Health West?
The medical services will be coming through them is what the plan is, through Health West, yes.
All right. Madam Chair, may I ask another question?
Certainly, go right ahead.
I know that this WellPath has been a discussion, but is there a recent event why this is taking place? I mean, what precipitated this?
Nothing precipitated it. As I had stated when I opened, this was an idea back in 2017. This is a different model that we're going to be looking at. Kind of stepping away from a healthcare system that's for profit. This is going to be an integrated system. Basically, Muskegon County taking care of Muskegon County is what the plan is going to be. I think we're going to find, without an increase in our budget, that we're going to receive much better service.
Madam Chair.
Yes.
Like a couple of things. One is I am concerned about the cost. Your sheriff, you're relatively sure that the cost won't skyrocket.
Yes.
Okay. And in answering or responding to Commissioner Laring's question, there were a couple of bad things that had happened with this healthcare provider. I don't know, maybe 3 or 4 months ago. I think it resulted in serious injury.
There were 3 deaths.
So this didn't just come out of the blue. I remember we had talked about it, but I think we wanted to be careful that we could terminate this contract without repercussions, and that we had another system in place. So but there was a raise, and it wasn't just in the last few weeks or month.
Thank you, Commissioner Skolnick. I do have a couple questions too. Number one, you know that Health West we're anticipating making them an authority, so you will not be working with the county on that. And also, I'm interested in finding out how we're coming on that. I've not heard anything from Health West. I'd like a report from them on how the progress of becoming an authority is. And I also have a question about whether Health West can actually do medical services along with mental health services, because it didn't seem to be that way in the structure that came from the state for community mental health.
I can, Madam Chair?
Yes.
Yeah, I can partially answer that.
Is Julia, well, let me just check a second, Marcia. Is Julia Rupp on still?
Oh, yeah, that would be obvious.
If Julia's not, then Marcia, go right ahead.
Yeah, Health West hires physicians, not just psychiatrists, but also physicians, just like the health department does. So even though the main focus is mental health, they can hire a physician that maybe provides, regular medical care.
I guess I was under the impression.
Yvonne, if you'd like me to respond, Commissioner.
Yes, Julia, please.
Oh, there's the answer. Okay.
Yes, we partner with Hackley Community Care. We'll continue to partner with them for some ongoing supervision. But we've had medical providers on our staff for a number of years and have been providing that service. And under CCBHC, sorry, let me take my mask off. Under CCBHC, we are required to have integrated primary care, behavioral health care. And that's the model that the sheriff is talking about. So
okay.
We currently do contract with the sheriff for behavioral health care. And so this will put everything under one umbrella. And we anticipate that we're going to be able to increase medical services, availability of medical services with the same amount of dollars or less.
Okay. And what about how long before you expect to become an authority?
The plan that we passed with our own board is that we have we hired one consultant. We ended that. Now we are we have another. We were given 3 months to put together a transition plan. We're 1 month into that. So at the end of the next 2 months, we will have a transition plan for authority status.
Okay, because we were hoping to have that done by the end of the year. So we're anxious to get that on its way. So let's be progressive in moving forward to that. Anybody else have any questions for Julia while she's on?
Madam Chair, I'd like to make a final comment before we vote.
Yes, go ahead, Commissioner Laring. I'm sorry.
Yeah, thank you. So I'm in favor of terminating the agreement with WellPath because of some of the past issues. I'm not necessarily in favor of turning this over to Health West to administrate it. Thank you.
Thank you. Anyone else? Seeing none, could I have a roll call, please, Madam Clerk?
Vice Chair Foster,
Yes.
Commissioner Hovey Wright,
Yes.
Commissioner Laring,
Yes.
Commissioner Mahoney,
Yes.
Commissioner Nash,
Yes.
Commissioner Skolnick,
Yes.
Commissioner Wilkins,
Yes.
Chairman Hughes.
Yes.
8 yes, 0 no.
Thank you very much.
Madam Chair, that ends my report. Thank you.
Thank you very much. Now we will move on to old business. Is there any old business to come before the committee today? Seeing none, how about some new business? Any new business? Seeing none, is there public comment? Anyone for public comment?
I see a hand by Tony Barnes.
Okay, Tony, go right ahead. Would you please unmute Tony Barnes so that he can speak? Thank you.
Thank you,
Tony, go
Commissioners.
ahead.
Thank you, Commissioners. Tony Barnes, 5920 Metamore Lane, Twin Lake. Say, I got a a question. I've been seeing a lot of activity on social media regarding our horses, for example, and animals that are being affected with respect to this COVID-19 also. I mean, if people are unemployed and these horses are getting malnourished, how is it budgeted at all through the county? Is it through the Muskegon County Fairgrounds? Is it through the sheriff department? How are we making sure? I mean, the cost of hay alone is just skyrocketing. I mean, I don't know that we have a huge staff that handles some of those calls with respect to our equestrians, but I'm wondering what the process is within the budget to make sure that we are fully funding that, because we're having a very difficult time. I'm seeing fundraising efforts all over that aren't having a ton of success. So there is a concern out there that if we're out there trying to save these horses or they're being surrendered, for us to take care of them. It doesn't make sense if we have that department if we're not fully funding it. So that's all I had today. But thank you for your time, and I do appreciate the opportunity to speak.
Thank you, Tony. We'll look into that, and somebody will get back with you on that. Thank you. Is there anyone else under public comment? I'm looking for hands. Is anybody's hand raised that I don't see?
No.
No more hands? Okay. No more hands raised. Thank you very much. Is there any additional comments from the board?
Madam Chair,
Yes, go right ahead.
I just wanted to apologize for my tardiness. I had a doctor's appointment.
That's okay. We hope everything's all fine.
Absolutely. Thank you.
Wonderful. Any other final board comments? I guess I'll make one comment since I see Fred Johnson sitting there. I just wanted to tell you, Fred, I'm glad to see the Public Defender's Office moving forward and some new people going. You've done an absolutely wonderful job there. You far exceeded my expectations from when you came. And I knew you were going to do great things, but you far exceeded my expectations. Thank you so much. I guess that's it. I will entertain a motion to adjourn.
So moved.
We have a motion and a support. We are adjourned. Thank you very much.
Madam Chair, did you
Yes.
get my message?
Realistine, I did not get your message, but I'll call you right now.
Oh, okay, very good. Thank you.
Thank you. Bye-bye.